Yeah.
Hello, Lizzie, and thank you very much for joining us this afternoon to share with us all your hints and tips on the pelvic floor. So, Lizzie is a physiotherapist and is the proud mummy to 3 young boys. And I will pass it over now to Lucy and let Lucy introduce herself.
Hi, thank you, Julie. So I'm Lucy. I'm a physiotherapist. Been a physiotherapist for pushing 20
Have we
years.
frozen?
It flies.
Are you still there, Lucy?
I am still there. Can you hear me?
No.
Oh, have I frozen?
This StreamYard is not working. Oh.
Am I back?
Then you're gone. Yeah, it's not going to work on this. I don't know what is going on. Let's see. Okay. Yeah, Lucy's frozen. Can you hear me, Lucy?
I can hear you, yeah.
Okay. Right, I'll let you go ahead and introduce who you are to everybody.
Hi, so I'm Lucy. I'm a physiotherapist. And my business is Lifestyles Physiotherapy and Fitness. So I help people predominantly with back pain and postnatally, helping them just basically get their core strength back, reduce back pain. They're very interlinked. So what I've got today is I've got 10 basic core tips that are to help you with your pelvic floor and your core muscles around your middle, so your transversus abdominis. So basically, if you've been working and trying to strengthen your abs or your pelvic floor for a while and you're not really sure if you're getting very far, or you don't think you're getting where you want to be quick enough, or you're still getting back pain, still getting pelvic floor symptoms, then basically I've just got my little checklist of things that you can try to see if there's anything that you need to tweak to make what you're already doing more effective. Okay, so it's not really to give a specific exercise program out because, you know, I couldn't be really specific to everybody. But if you've got something that you're already doing or something that you found on YouTube and it's just not working, then yeah, just have a look through this list and see what really applies. I've also got some slides as well, so I can post a daily tip so that when people look back through, they've then got the tips there to refer back to, and then they can add any comments if there's any questions about anything specifically to them as well. Right, so my tip number one is really just to do with posture. So when I refer to the core, I'm talking about our diaphragm kind of sitting here and talking all the way down to our abdominal muscles and then to our pelvic floor. So when I say core, I'm referring really generally to the whole lot. So regarding with our posture, if your core isn't improved,
her end or is it my end?
Is it working? Can you hear me? Right, Julie's gone. I don't know if anybody can hear me or not. I can't see any comments because I'm not the host. But it's saying everyone can see and hear you. So maybe I just carry on for a minute. So my first tip was regarding posture. So our whole core funnel, from our diaphragm, our abdominal muscles down to our pelvic floor, our muscles work best at the correct length and tension relationship. If you imagine it like an elastic band, if you're holding your elastic band and the ends are too close together, it's floppy and it doesn't really do a lot. Again, you stretch it too far and it's really, really tight the other way. So you're wanting to be somewhere in the middle. So if you imagine if you're kind of slumped down, then at the front, those muscles are going to be baggy because they're going to be closer together. So they're not going to be at a great length to contract properly. The same with if in pregnancy you've had a really arched back and you're kind of curved from the side. So if I was to sit side on, I don't know if you can see me, if I was to really arch back here, that would stretch me here. And then again, those muscles wouldn't be in an optimal position to work. So sometimes it's just about finding a nearly neutral posture, somewhere that's comfortable, not too upright, not too slouched. And you can find that by, if you've got your hands with your fingers on the front bones on your pelvis. So if you're coming kind of here and you're palpating on the bones, all you're wanting to make sure is that you're not tilted backwards and you're not tilted forwards. So if you imagine a pail of water, I'm not in the middle of the screen, so I don't know what's happening with this. Yeah, if you've got your pail of water there, you don't want to be tilted forwards and you don't want to be tilted backwards. You want to be roughly in the middle. And that's going to give any exercises that you do the best chance of working. So then my next tip is what's happening with your breathing. So if you're trying to work your core muscles, so if you're trying to contract your pelvic floor or your deep abdominal muscles, if you're trying to close a diastasis recti, then if you're not breathing properly, then you won't be able to recruit the muscles as well. If you imagine if you're holding your breath and then you're trying to work your muscles, you can't work them very well for very long, and you're holding everything really tight and you run out of breath and you let everything go. So the first technique is really the diaphragmatic breathing. So you have your hands onto your lower ribs, and you want to see is as you take your deep breath in and out, is that your rib cage, it does this. So it's expanding out. You will still get your tummy distending outwards, but you won't get so much of a upwards pull, and you won't get a downwards pressure either. So it's just making sure you've got a breathing technique that isn't putting more pressure on the core, and also is allowing you to use your core and that you can recruit those muscles whilst breathing. So specifically for pelvic floor, it's if you imagine you're going to do your contraction on your out breath, and then you're not tempted to breath hold, and then you can just start to cycle your breathing normally from there. Exactly the same with your transabs exercises for your deep tummy muscles. Okay, tip number 3, are you sure of what you're working? If you're not, it's worthwhile getting checked out if you're finding that you go through my tips and you're still really not sure. So specifically for your pelvic floor, when you're contracting that, if you imagine you're going to stop yourself passing wind, or you're going to imagine you're going to zip yourself up from front to back and then carry on up towards your belly button, it should feel like everything inside pulls upwards. It shouldn't feel like a bearing down or pressure or any heaviness down below. If you're not sure that that's happening, then it's worth getting checked out with a pelvic floor specialist physiotherapist. In terms of your transabs muscles, this is separate from your six pack, so it runs deep to that. And these are the muscles that look after your back. They help support your back and help you move each individual segment of your spine rather than a big movement all at once. So with these, because they run around your front, if you palpate those same places on the front of your hip bones and you take your fingers down an inch and in an inch, and then if you contract in your pelvic floor, you should feel that little bit of tension coming in under your fingers there, because your pelvic floor and your transverse abdominis, they should basically work together and co-contract. It's also a good tip if you're not sure about your pelvic floor, if you draw your belly button in towards your spine and you're feeling that tension under your fingers, the chances are your pelvic floor probably start to work a little bit as well. Okay, so yeah, get checked if you're still not sure on that. My tip number 4 is don't rush with activation and be mindful of how you're doing it. So in our pelvic floor and in our transversus abdominis, we have slow fibers, so parts of the muscle that work slowly, so they work a little bit all of the time. And then in our pelvic floor as well, we have more fast fibers as well, so they work quickly all of a sudden when we need something. So for instance, the slow fibers are what's keeping your water in throughout the day. They're what's stopping you passing wind most of the day. So that's what your slow fibers will be doing. And then your fast fibers will be making sure that those functions are still happening when you cough, when you sneeze, when you jump, anything that's putting a sudden pressure on that core cylinder. Yeah. So you need an element of fast fibers and slow fibers working. However, lots of programs will say you do some slow work and some fast work. So you have contractions that you build up slowly and some that you do quickly. However, if you're really not sure exactly what you're doing, my recommendation is usually to start with the slower contraction. So if you imagine you've got a sponge, put my hand in the picture, and you're squeezing the water out of it, and you're just building that tension up, and you're building it up until you've got a really good firm grip on it, and then you're relaxing it off. So you can take that analogy and either use it with your pelvic floor. So you start the contraction lightly and you build the pressure up and up and up. And the same when you're doing your transabs. So you're drawing your tummy button in ever so gently, bit by bit, and building the pressure up. So the reason to do the slow fiber work and build up the tension slowly is because sometimes if we just go quickly and we're working a muscle that's weak, we'll choose another muscle instead that's quite happy to contract. So if you're trying to do your pelvic floor, you might find that your thighs are trying to squeeze together, or you're squeezing your bum muscles, your glutes really hard. And when you're doing your transverse muscles, you might find that you're starting to try and do a little bit of a crunch at the same time. You're just not quite getting the muscles that you want to work. So sometimes it's just about making sure that you're working the right muscles in the right way, doing the right exercises, but just being a little bit more mindful. So tip number 5 is a really simple one to help increase your pelvic floor function. I don't know how many mums of small ones are going to love me for this one, but it's reduce the caffeine. Okay, so caffeine is an irritant of the bladder, and that's going to mean that you're going to want to empty your bladder more often, and you're going to be using your pelvic floor more often and make it sensitive. And when it overworks, it then actually gets weaker. So taking away that bladder irritant is automatically going to mean anything that you do to strengthen it up is going to be a little bit more effective, because it's not working on that background of having been to the toilet 20 times already today. And then the opposite scenario to that is we're increasing the water, because your water isn't an irritant, and it also helps aid your digestion. And if our digestion is good, particularly in pregnancy, or if we're taking any painkillers, digestion can be slower, which can mean basically that you're straining on the toilet more, which is going to weaken your pelvic floor, potentially damage it further if you've got any sorts of a prolapse, or any weakness there already. So anything that can stop you straining and bearing down is a bonus. So those two go hand in hand, really. Have a cup less caffeine and a cup more water, and try and build that in as a habit. Okay, tip number 7 is all about consistency. So if you've been doing some exercises for your pelvic floor and for your core, and you're not seeing the benefits that you were hoping to, or you started to see benefits and then that slowed down, what you're thinking about really is being honest, is have you been consistent? Have you stuck with daily? Or if daily isn't part of your routine, have you stuck to the 5 days that you promised yourself that you would do? Have you scheduled them in? Because it's often only when we're consistent that we'll start to see the results. Some of that is down to muscle memory as well. Our muscles will remember what it is they're supposed to do the more often they have to do it. And in terms of evidence for the pelvic floor, the strengthening programs are shown to take anything upwards of 16 weeks to get the full benefit. So please don't feel disheartened after 6 weeks, 8 weeks. If you're seeing very gradual changes, just keep going with what you're doing. The chances are you're doing it right. Obviously, if you're getting to that point and you're seeing nothing, it's going back to, are you sure of what you're working, and do you need to see somebody to check about that in a bit more detail? But yeah, 16 weeks is the golden number from the research. My next tip is relating to how you progress your exercises. So regardless of which bit of the body you're working, you've got your ways that will generally progress exercises for function and for strength. So we either progress the amount of weight that you're using, so you're increasing the load, or you increase the position, so you're doing it in a more challenging position requiring more balance or against more gravity. So it might be you start in lying, you go to sitting, you go to standing, you maybe even go to one leg balance or jumping. Then our other options to progress is the number of reps that we do, and the last consideration is how much fatigue we work into. So when we self progress, sometimes we can either progress too many of those things all at once, or progress not quick enough and stay in the comfort zone a little bit too long. So have a think about if things have got worse potentially. Have you increased too many of those things too quickly, and then things have just got too tired and fatigued and overworked? Or are you actually not doing enough, and in which case you can just try and up it a little bit from there, but just picking one of those variables at a time to increase and taking it from there. Tip number 9 is listen to your body. So if you know that you're wanting to work your pelvic floor or your core, and actually you're feeling it working somewhere completely different, or you're clenching your jaw or you're holding your breath, then that's your body telling you you're not working where you're intending to work. So it's just going back to basics, rechecking your technique and taking it from there. Again, if you're doing something and it's giving you pain, that's also worth getting that reviewed. Is it a case of you just need to alter your posture and your alignment in sitting or lying before you try and do the exercise, because you might just be working another muscle that you didn't plan on working, and that's starting to complain because it's doing a job that it's not supposed to do normally. So yes, listen to your body. When you're doing exercises, it's okay to feel some fatigue towards the end, so long as that eases quickly. And the same with pain. If you're doing an exercise and you've been told it should be painful, not really the case in pelvic floor or core, but for other areas of the body, it then should settle quickly if you're told that it's supposed to happen. And the last one, I think I've probably said it in combination with a few, is that if you're in doubt, seek a professional assessment. So if you've given your exercises a good chance and you've gone through tips 1 to 9 and you think, actually, I can't really self-help myself anymore, go and get yourself assessed. Certainly I can recommend a pelvic floor physio locally in the Coventry and Leicestershire area, and I know Julie's got quite a lot of contacts for anybody that sort of seeks an internal assessment. Generalised core assessments and back pain assessments I do myself, but yeah, there's lots of people in the area that you can go to for that. But yes, if in doubt, do ask, and that can often save you time as well. So yeah, that's 1 to 10. So what I'll aim to do is post a tip a day, perhaps in the group, if that's all right with Julie, just to give you the pointers, and then you can refer back to them at a later stage and just go with which ones feel relevant to you. You know yourself, or if you look in the mirror, if it's posture, you know if your breathing technique feels like it's coming from lower down or further up. You know what your water intake's like and your caffeine intake's like. You know if you're being consistent. So yeah, if you've worked your way through the list and you're still struggling, just seek some help. Right, so I don't know where Julie's gone or if she's coming back on, but I'll finish off there. If anybody has any questions for me, just drop them on the Facebook page, or I can be found on Facebook under Lifestyles, Physiotherapy and Fitness, or just by on my personal profile by my name. But yes, there's always an option to leave any questions in the group and I will get back to you from there. Okay, right, have a lovely rest of your day. Thank you, bye.